Hello everyone, this is a PSA for all athletic trainers out there on how to prevent and manage skin pathologies, as well as who should be educated against them and how they are transmitted. Starting off with the best way to prevent these pathologies is to make sure we are disinfecting and cleaning any frequently touched surfaces, as well as washing our hands when they are visibly dirty with antimicrobial cleanser in the correct hand washing technique. Additionally, we can discourage our athletes or anyone we come in contact with to not share towels, gear, water bottles, shaving razors, or hair clippers. Additionally, we can make sure that our athletes are provided with the proper materials that are needed for proper hygiene techniques, as well as encouraging them and making sure they are showering after every single game or practice. With this, we can also make sure we're holding our employees and other administrators accountable for adhering to our policies that prevent the spread of these pathologies. As well as us as athletic trainers, we can use antimicrobial hand sanitizer, and that is alcohol-based when our hands are not visibly dirty before and after touching any exposed skin. A few other helpful tips and tricks for preventing these skin diseases is making sure you have a strong custodial staff, as well as your team has a local dermatologist they're in contact with, and making sure athletes are avoiding any common tubs with any open wounds. The main people who need to be educated against these skin diseases is administrators, coaches, and your athletes. Administrators should be educated on the policies that are in hand to prevent the spread of these diseases and how to properly enforce them. Coaches should also be educated on these policies, and we should make sure that the coaches are adhering to these policies. Athletes should be educated on proper hygiene techniques and making sure that they are provided with the proper supplies to do so. It's also important that athletes know that they should be reporting all abrasions so that they can be properly treated, covered, and cleaned daily. It's also important that whoever is in charge of doing laundry is educated that should be being done daily and using the correct products to do so, as well as making sure your staff is using proper disinfectants for all the cleaning that is being done. There are 3 different kinds of skin diseases. There are fungal, viral, and bacterial. Tinea capitis is a type of fungal skin disease that is diagnosed through a culture of the skin lesions. It is then treated by a systemic antifungal for at least 2 weeks before return to play. Another fungal skin disease is tinea corporis. This is also diagnosed with a culture of the skin lesions. This skin disease is treated with a topical antifungal agent for 2 times a day or with a systemic antifungal. An athlete with this condition can return to play after 72 hours of the antifungal if all of their lesions are fully covered. Moving on to viral infections, herpes is diagnosed with a culture of the skin scrapings, or with a snonk smear. Herpes is then treated with an oral antiviral medication. The athlete may return to play if they meet the following criteria. They are systemic, symptom-free, they have no new blisters for 72 hours, all their lesions are covered with a firm, adherent crust, and they cannot just be covered to return to play, and have a minimum of 120 hours on that systemic antiviral therapy. Another viral disease is molluscum contagiosum, which is diagnosed by clinical findings and a microscopic injection. It is further treated with an antidotal therapy and physical destruction of the lesions. The athlete may return to play, and when the lesions have fully all been destroyed and are recovered. When it comes to bacterial infections such as impetigo, folliculitis, and MRSA, they're all diagnosed through history, appearance, and cultures. They all have the same return to play as well, such as no new lesions within 48 hours, a completion of 72 hours of antibiotics, and there's no new drainage from the wounds. For all these pathologies, treatment is also dictated by the type of culture and the sensitivity of the infection. When it comes to impetigo, it's been shown that topical treatments have been effective. In addition to the return to play protocol I mentioned before, all lesions should be cultured and tested before they return to play. When it comes to folliculitis, the athletes should be referred for incision and drainage and culture of the wounds, as well as antibiotic therapy must be initiated, and as I mentioned before, the return to play protocol is the same for all of these bacterial infections. Lastly, when it comes to MRSA, you want to keep in mind if an athlete may report any spider bite type lesions. These can be very similar in appearance to MRSA. as well as athletes that have any suspicious looking lesions must be isolated to prevent the spread to further teammates, and athletics must be determined on a case-by-case basis. Lastly, when it comes to the transmission of any of these pathologies, there are three main elements. There's the source of the agent, the adequate host, and the mode of transmission from the agent to the host. When it comes to transmission, some factors to consider are the immune state of the patient at the time of exposure, the virulence of the infectious agent, the quantity of infectious inoculum, and the medications that the patient may have been taking at the time. Skin diseases can be transmitted in multiple different ways, including direct and indirect contact, droplets, airborne, percutaneous, or mucous membrane exposure. Keeping all of this in mind, we can hopefully help keep our athletes safe and make sure everyone is adhering to the correct policies to make sure that these skin diseases do not spread.